All right, we've been talking about it. Nicki Minaj's tweet about skipping the Met Gala over its COVID-19 vaccine requirement is still getting more reaction 48 hours later. Even the White House top doctor, Anthony Fauci, is weighing in on this issue. It's not the praise Nicki Minaj would likely hear walking the red carpet. Just the opposite, with the rapper barreling into some COVID-19 controversy. This after a tweet on Monday. In the post, she said she would not get vaccinated solely to attend this year's Met Gala, tweeting first if she eventually gets the shot, it'll be once she's done enough research.
You can't be a scientist until you have actually taken the classes in science. And I just don't really know how many ways we have to say this. You know, Nicki Minaj can't do any research to say whether she should or should not take the vaccine because she doesn't have the basic knowledge and the basic acumen to be able to understand what molecular biology actually is. The only thing she's going to be able to do when she talks about research is to talk to some people that will tell her some things, and 99.8% of doctors would tell her that she needs to take the vaccine.
In a second tweet, Minaj detailed a bad reaction she says her cousin's friend had with his testicles after taking the COVID-19 vaccine, telling her more than 22 million followers, prompting this response from President Biden's chief medical advisor, Anthony Fauci, when asked about Nicki Minaj's tweet.
The only way we know to counter mis and disinformation is to provide a lot of correct information and to essentially debunk these kinds of claims, which, may be, innocent on her part. I'm not blaming her for anything, but she should be thinking twice about propagating information that really has no basis as except a one-off anecdote. And that's not what science is all about.
Media commentators weighed in as well, with cable TV host Joy and Reid calling out Nicki Minaj, tweeting, quote, "For you to use your platform to encourage our community to not protect themselves and save their lives. As a fan, I'm so sad you did that." And of course, Minaj fired back at Reid, posting, quote, "This is what happens when you're thirsty to down another black woman." Although the controversy doesn't seem to be letting up anytime soon, Nicki Minaj has managed to spark more conversations about COVID-19 and what medical experts say it has to take to protect yourself from a virus which has killed more than 660,000 people in the U.S. All right, well, with me now to discuss some of the health issues which have come up in the aftermath of these tweets are OBGYN Dr. Jamil and Idris Abdur Rahman. As you can tell, they're twins, and we're absolutely happy to have you both on our show here at BNC Go.
Thank you. Good to be here.
Dr. Jamil, let's start with you. There's so much information out there on social media, and beyond Nicki Minaj's tweet, how difficult is it for healthcare professionals to combat misinformation or incomplete information during this time?
It's really difficult because everybody's got a platform. You have absolute information equality now, which is a great thing when it comes to many things. But when it comes to medicine and when it comes to science, it's not such a great thing because everybody's got a platform to share their experience, to share their opinion. Unfortunately, they don't have the requisite knowledge and education and platform to understand necessarily the information that they are consuming or sharing. And so it makes it very difficult because when people have hours to be on their phone looking at misinformation, and I have 2, 3, 4, maybe 5 or 10 minutes to break things down for them in the office, I'm at a disadvantage that oftentimes I can't overcome. And it makes things very difficult and very frustrating. But at the same time, you recognize that people are doing what they think is best. They are trying to process the information in the best way they know how. But unfortunately, it puts us in a position where we have to combat misinformation before we can actually share legitimate information. And it makes it tough.
Yeah, a lot going against you. Dr. Idris, when it comes to sexually transmitted diseases, what are some things young people, especially right now during this pandemic, need to know?
So, it's funny. I've been talking to people here on Labor and Deliver about how busy we've been. And we've been busy because we're kind of experiencing that delayed COVID boom, which means that people are having sex. And so what I tell, and unprotected sex, and what I tell all of my patients, young, old, and otherwise, is that even during a pandemic, as I know we are worried about getting COVID and what can happen with COVID, all those other diseases that were out there before COVID still exist. And, with this tweet about Nicki Minaj's, I think it was her cousin's friend or whatever, with his swollen testicles, maybe it was COVID related. There have been some cases of COVID infecting the testicles, but it also could have been an STI. A lot of times when men get gonorrhea, chlamydia, STDs like that, it can cause what they call epididymitis, which is basically swelling of the testes, orchitis, and the tubes that go to the testes. So I tell all of my patients, COVID, no COVID, we still need to be protecting ourselves. That means safer sex practices. We're talking condoms, barrier protection. Birth control pills are great, but you've got to use that barrier protection, which means condoms all the time.
Yeah, no, good advice right there. Now let's tap into more of the COVID-19 aspect. Dr. Jamil, as an OBGYN, what are you and your colleagues seeing when it comes to patients surrounding COVID-19 at this time?
Well, for sure, we're starting to see infection rates rise a little bit. And I think that in part is because we've let our guard down and we're not taking the same precautions and we're getting too comfortable again. And so we're seeing infection rates rise. We are also seeing a large amount of vaccine hesitancy, and we have a large minority patient population. And vaccine hesitancy amongst minorities is rife, and it's understandable if you know the history of medicine and how sometimes minorities have been treated by the medical establishment. But we're starting to see COVID cases rise, and unfortunately, not only do we see more COVID cases amongst minorities, like Black people were 3 times more likely to get it, but because we have a lot of the comorbidities that can lead to bad outcomes from COVID, like high blood pressure, diabetes, heart disease, underinsurance or no insurance, we're seeing more deaths amongst minorities as well. And so unfortunately, we're at a point now where we can turn a corner. We can get to that point where we have herd immunity if we can get 80%, 90% of people vaccinated. But I feel like we've kind of hit this wall in general, and especially amongst minority communities where a lot of folks are becoming resistant. Cases are rising again. We're starting to see deaths again, unfortunately. And you add to that the fact that there's COVID fatigue and mask fatigue and vaccine fatigue. And you have people who just don't want to hear it, don't want to be bothered. And I feel like we're not necessarily taking a step back, but we've certainly gotten stagnant and we're not taking a step forward.
Yeah, no, the stagnant part is completely true. It takes us to the next question, which is about vaccinations. Dr. Idris, what has been your way to persuade people that are very still vaccine hesitant at this time, especially younger people? They're sometimes to blame that they don't want to get vaccinated just yet. What do you tell them?
We have a lot of good tools out there, and what I tell patients, and, I'm a pretty down to earth person, and I had a patient in my office yesterday and, she's pregnant and I said, you're going to get your COVID vaccine. And she said no. And I asked her why. And she said, I'm just not really sure. And this is what I tell people all the time. I say, first of all, obviously the COVID vaccine is new because COVID is new, right? But the type of vaccine that the COVID vaccine is not a new vaccine. We've had them around for years and they've been well tested in people of all ages, pregnant, non-pregnant. So it's not really that new. That's the first thing. But I tell my patients, even if you don't know what the COVID vaccine does, and it's been used by millions of people worldwide. So we do have some information now. But even if you don't know what the COVID vaccine does, what you do know is what COVID does, and COVID will kill you. And then also you just have we have methods of persuasion, more and more places are saying if you're not vaccinated, you can't come in, and that's including doctors' offices, hospitals. And so there are ways to encourage people to get the vaccine. I was talking to my barber and he said, his wife who works for the government was told to get the vaccine by October 1st or you're fired. And she said, what should I do, honey? And he said, did you win the lottery? Get your vaccine, So luckily we've got a lot of options with, kind of talking to patients about the benefits of the vaccine versus what we know about COVID. And then there's just a lot of policies that are going to kind of push people to get that vaccine, whether they want to or not.
All right. Well, a lot of good information. Drs. Jamil and Idris Abdur Rahman, thank you so much for joining us. We hope to have you back on our show sometime soon.